Great. Hi, everybody. Welcome to the People-Powered Health breakout session. You're officially the most important people here because you're all here, so well done for that. I'm just going to reinforce that if you are willing and able to come as central as possible, so our speakers have an audience to talk to that's in one place. So if you don't mind, if you are happy to move in, that would be great. I'm not going to talk because we've got a great group of people to share their perspectives with us this morning, this afternoon even. This is really about how do we, in partnership with people and the professionals, work to deliver what matters most to people. And we've heard a lot about preferences and diagnosing preferences. I fundamentally believe about looking at the whole person, so physical, mental, social needs. It's one group of needs that an individual has. And I'm looking forward to hearing the perspectives from our speakers. And just want to thank Clive and Angie at the front as well, our nominated People's Panel members, to make sure that in the Q&A we are focusing on what matters most to people. Thank you both for being here. We're going to try and rattle through relatively quickly, and I will let each of our speakers introduce themselves in turn in the interest of time. But we're joined here by Alison Austin, David Russell, Ian Silver, Charlotte Beck, and Nina. Sorry, I didn't catch your surname. Thank you, Nina. Who are each going to present some perspectives from both health and social care fields. So I will pass on to Alison at that stage. Thanks.
Great. Thank you very much. If I can. I don't know how. Yep. I'm Alison Austin, and I'm Personalisation Lead in NHS England. What I'm going to talk today about is one particular programme that we've been piloting and are starting to roll out, which is personal health budgets. Personal health budgets, they're not about new money. They're about using money that would have been spent on somebody's care, but using it in different ways, enabling them to meet their needs in ways that work for them, rather than the ways that the NHS says should work for them. But they're also not about giving somebody money and telling them to go away. This is about care planning. It's about working in partnership, harnessing a professional's knowledge of what they know, the clinical evidence, and with the patients, with the individual's knowledge about what works for them, what doesn't work for them, and how you can do things differently. It's about taking a holistic approach, really integrating health and social care and beyond, looking at an individual's whole life and their family. But I think it's really important to say that personal health budgets have got the NHS constitution at the heart. This is about free comprehensive care at the point of delivery. It's just that delivery is very different. For those of you that are interested in evidence and why we're doing things, personal health budgets were evaluated in a pilot that ran from 2009 to 2012, involving around 2,700 people. And that showed personal health budgets will not cure your long-term condition. It would have been nice, but they didn't. What it does do, though, is they reduce the amount of contact people need with social care, with secondary care, in particular hospital admissions. It meant that people can live with their long-term condition. Their perceived health is better, how they feel about themselves. And also, their family members, carers, their own health and the health of their loved ones, which is absolutely fantastic. And actually, it's cost-effective. Cost neutral, and in some cases, a lot of cases, actually it can save money, particularly in things like continuing healthcare, where there's a lot of domiciliary care agency provided support. So the end of the evaluation, and November last year came, and we had this positive, wonderful positive result. We decided, government decided that they would roll out personal health budgets. And from April 2014, everybody who receives NHS continuing healthcare will have the right to ask for a personal health budget. Obviously with the intention that if you ask, there has to be a reason why not, rather than just to say no. And actually in the mandate, there's a clear commitment that people with long-term conditions who would benefit would be able to have the option of a personal health budget. Who benefits? Well, we know from the pilot that they're people with more complex needs, those people who use the NHS more. Quite often those people who are normally accessing, attending, going to hospital quite a lot. These are the people that we think can really benefit. You won't be able to read much on this slide, but this slide was made after one of the events that we held with budget holders, and it captures some of the things that they said about personal health budgets, the difference it made to their lives. And to demonstrate that, I want to tell you Nikki's story very, very, very quickly. She's a lady in her 30s. She has acute rheumatoid arthritis. She had some very severe flare-ups. The year before she got a personal health budget, she was in hospital for over 6 months in large periods of time, because when she had a flare-up, that was all the NHS could do, was put her into hospital. Quite often, she would end up in a renal unit or anywhere where there was a bed. She was in there for a long period of time. Her personal health budget has enabled her, she's got a hospital bed, so that when she does have a flare-up, she can get the postural support that she needs. She can also get carers to come in to help her, and her medication given at home and nutrition supplied. She hasn't been into hospital in the year following her personal health budget, which is fantastic. Fantastic for her, fantastic for her family, and fantastic for the system. There are lots of other stories on our website, which I'll give you the link at the end. So, 2014, everybody receiving NHS continuing healthcare will have a right to ask for a personal health budget. That means CCGs need to start thinking about it now. Every CCG is going to have the capability and the capacity to deliver personal health budgets, which is quite scary, because some of them haven't started thinking about it, but there is help. There is a personal health budget delivery team who have developed what they're calling an accelerated development program, which is just starting now, which CCGs can join up to and actually get help to get ready and get up to speed. There's a whole load of other regional support. There's a peer network for budget holders, the People Hub. There's online learning, there's progress tools. So there are things that NHS England is doing to help CCGs get up to speed. And that actually, I think I've gone a lot less than my 7 minutes, which, considering it's the end of the day, is quite a good thing. Just want to highlight a couple of websites to you, one of which is the Personal Health Budget website, which is everything that I'm talking about today. But the other one is something about wider patient participation and work that NHS England has done, and guidance which sets out what we mean by patient participation in the terms of involvement and engagement in services, but also the individual patient participation, things like peer support, self-management and things like that. And you can find a lot more information about that on that website. And I'm now going to help, and I forgot your name, it's terrible. David, sorry, I'm now going to hand over to David.
Great. Hi, everyone. I'm David Russell, and I'm the head of health and social care programs at SPICE. So quite an unusually named organization to work in the NHS, I think. But so what we do, we develop agency time banking programs in services and communities. And we're originally an organization that started in the Welsh Valleys, but now work across England and Wales. And we print money effectively based on time, so kind of an interesting contrast to kind of personal health budgets. So we print what we call time credits. So they're cash based on the contributions that people make in time. So for every hour that someone contributes to a service, an organization, an agency, a community, you earn 1 time credit. So 1 time credit is always equals 1 hour, and each community or organization that participates prints their own currency, or we print it with them, and all the backs are the same. So it's an evolution of traditional time banking where you clock up your hours and you record your hours, and we add in a currency element and use some of the really good things about currency, but really think very deeply about the value of people and the power that really comes from when people give time, and really rethinking how valuable people are and people's time is. So when you earn a credit, you can do about 5 things with it. So you should be able to spend it where you've earned it. So if that was a day centre, you would be able to spend your credit at the day centre to perhaps access a party, a disco, an event, or another service that's happening there. You would be able to bring it to another organisation in the community. So in West Norfolk, for example, you can bring it to over 70 local community organisations. So this would be someone potentially from a day centre going to a community centre, going to a non-health and social care organisation to spend a credit. It could also be a school. It could be any sort of organisation that takes part in the time credit programme. You can also go to what we call corporate partners. So we involve the private sector, and we sign up private sector partners across the country. We have about 200, and you can spend them there. So you can go to the British Museum. So for 1 hour, an exhibition of 1 hour, you would use 1 time credit. You could go to St. Paul's Cathedral. You can go bowling, you can go swimming, you can go to the cinema, you can do lots of things, but all these things are based on what people like to do. So this isn't prescriptive. This isn't you should get healthier, you should be a different type of person. This is you should have fun, you should live life the way you want to live it, you should be valued, you should do things that you want to do, and you should be able to shape things you want to do and access more things. And we have menus that outline all of these things. So we work with lots of councils, for example, and in Lancashire, another example would be you can access all their adult education courses through time credits. So if it's a 16-hour course across a semester, that would be 16 time credits. You can access all the council partners. We work with 7 council partners. You can access all their swimming, all their library services. You can get genealogy sessions. If it lasts an hour, it takes a credit. And then you can do other things as well. So if I helped you for an hour and you had a credit, you could give me the credit to say thank you if you wanted to. So you can still kind of pass them person to person as a way to say thank you, but that's completely up to you if you want to do that. And you can also take them around the UK. So they're accepted in about 400 places across the UK, and you can take them all across the UK, and people gift them, they send them. We have grandparents, you know, who may not be very cash rich, but would have volunteered throughout the year and saved up some credits. And they would often, we've lovely stories of people posting these with bunches of credits as Christmas presents or for birthday presents for their grandchildren, and vice versa as well. So that's the outline of the model. And the whole ethos behind all of this is very reflective of what you talked about, is co-production for us. So everything we talk and think about is about how services can be delivered with people at the center. That is absolutely everything for what we do. Time credits don't exist. You know, most services don't exist without people contributing time. So at the heart of that is professionals and users and patients coming together, as well as the wider community. So we don't work always in very sector-specific groups. We always work to invite the wider community in and to work outside of that as well. So these are just some of the examples. We work in health and social care, housing, schools, lots of education, public health with carers. We also work with commissioners to write co-production into commissioning, into support planning, into person-centered plans, and always reflective of what people want and what the outcomes of those services or areas are. Some of the impact is starting to come through in our projects. We're doing a large-scale external evaluation at the moment, and we're finding that there are lots of impact. You know, if someone's going to the gym for the first time, that has a physical health impact, but actually people are having more fun. They're spending more time together. There's the social capital element as well. People are reporting that their quality of life is improving. That's 62%. And what we're finding is, in this survey at least, you know, more than half of people had never given time before. And that's a really important figure for us, and quite a diverse figure as well. So that is my last slide. I think I'm going to finish really quickly. But I've got booklets and case studies and things, so come and find me afterwards or ask questions if you need anything else. Thank you.
Hello there, good afternoon. Oops. Sorry, can I just give you that? Thank you. Good afternoon. I'm Ian Silver. I'm Operations Manager for Self-Management UK. And Self-Management UK is one of the country's leading providers of self-management support for people with long-term health conditions. And our programs have been built on about, I think it's over a decade, it's about 13 years now, of learning, development and experience of delivering support for people with long-term health conditions. And we're one of the lead organisations in innovating and developing new ways and more effective ways of supporting people with long-term health conditions. This afternoon, I'd like to present to you a case study of one of our self-management support programmes in partnership with a career development group and the Welfare to Work programme, which is a government-sponsored back to work and employment initiative. As I was doing the slides for the presentation this afternoon, I was reminded of an article in the national press last year, and I wanted to share that article with you. briefly. A gentleman arrived late for his appointment with his employment advisor, and on arriving he was informed that effectively he had two choices. One of those choices was to turn up on time, and the other choice was to face sanctions on his welfare benefits. Now, the gentleman turned around to his advisor and said, actually, there's a third choice. And with that, he pulled out a knife and cut his wrists. It turned out the gentleman had a history of mental health conditions, severe depression, and a long history of severe arthritis. Now, I do appreciate that's quite a rare and extreme situation, but I think it does highlight that actually the challenges individuals face having long-term health conditions, trying to get back into the workplace and employment, and also the challenges that advisors face when they're trying to support individuals back into work with long-term conditions. The gentleman isn't alone. 30% is the number of people in the UK who have a long-term health condition. 30% is also the number of people who have a mental health condition if they have a long-term health condition. 46% is the number of people who have a mental health condition who have a long-term health condition. I think I got those two mixed up. Apologies. And finally, 19% of people who are unemployed are considered long-term unemployed because they've been out of work for 24 months or more. There we go. We were commissioned in 2012 by Career Development Group and in partnership with the Welfare to Work programme to deliver 16 six-week self-management support courses. And participants are referred to our courses by the employment advisors. Participants who come on our courses are experiencing long-term unemployment of 24 months or more. They have one or more long-term health condition. They suffer from a range of mental health conditions, commonly severe depression, and they experience quite significant socioeconomic challenges in getting back into the workplace, particularly because of their long-term health condition. Our courses provide 6 weeks of support and training to participants in a number of different areas which enables them to become better self-managers of their long-term condition. The courses are based on behavioural change methodologies which enable participants to integrate a suite of toolkits, techniques and action plans into their lifestyles. The courses also provide psychological methodologies increasing confidence and communication skills. The courses are delivered by trained and qualified long-term conditions tutors who also themselves have long-term conditions. And our work is partnership driven. And I think this shows the kind of importance of collective working and joint working in that we work with the advisors and the organisations in trying to find the best way for people to manage their condition and their process of getting back into employment. So what was the impact of our courses? Just quickly, because I appreciate the time is ticking down. We evaluate our courses using the Health Evaluation Impact Questionnaire, or HiQ for short, which was developed by the University of Melbourne. And that measures a range of health impact outcomes, both psychological and skill changes. The improvements we've seen a significant increase in confidence by participants on the courses, increased communication and improved communication between them, their advisors, healthcare professionals, and generally an increase in self-management of their long-term health condition. We have an 80% retention rate, and we have 110 course completers to date over the last 12 months, 12 completers per course on average. So in conclusion, through the delivery of our courses over the last year, we've seen a significant increase in people's ability to manage their long-term health conditions, which was what the original brief of our delivery was for. But in fact, anecdotal evidence suggests that at least half of our participants, through coming on our courses, have now engaged with further education, training and workplace opportunities. And one of the things we're looking to do is to get funding so we can work more with our commissioning partners so that we can do more longitudinal evaluations which are aligned to hard outcomes of the welfare to work providers. What does this demonstrate? Well, it demonstrates to us that over the last 12 months, once again, helping people to help themselves manage long-term health conditions has a significant impact on not only the individual, but communities and the health service as a whole. Thank you ever so much for your time. Thank you. I'd like to hand you over to Charlotte and Nina.
Hi, I'm going to talk to you about New Leaf Enterprises. We're an employment service which is based within a forensic mental health setting. So the John Howard Centre and Wilson House provide medium and low secure services. We receive people from either psychiatric care or through the prison service. We provide individual support to try and help rehabilitate them back into the community. So it's therapeutic interventions to try and reduce risk. Employment's often overlooked at this stage in people's care. Employment's important in your well-being, let alone people who have gone through experiences of mental health and may have an offending history. Employment can build confidence, it can help you with your self-esteem, it's somewhere to challenge yourself and achieve something, as well as just giving you financial independence. So this quote really says it all. A job provides money, social networks, relationships, confidence, satisfaction, personal fulfillment, a sense of achievement. This is what I am, this is what I do. I'm no longer a mental health condition. So New Leaf Enterprises were set up about a year ago, and we now have 6 projects based within the unit. So we provide real working experience for people to train and develop themselves within their chosen sector. I'll explain to you in a second what the services are. There's opportunities to progress into paid employment, so that's where they'll then be leading a team and supporting those trainees to then undertake the work and to build up their skills. So it's promoting recovery to help them build the skills while they're in the units to then go straight out to the community with a full CV and with a reference as well. We provide holistic programs, so we provide individual advice and guidance on the side of this, to help look at CVs and job applications and disclosure issues. The services themselves are competitively priced and high quality services where providing services are needed and trying to generate income which is then reinvested. So the services that we have, we've got the Oasis Cafe, New Leaf Print and Design, which Nina will talk to you about in a second, a landscaping service. So we've got a few contracts within the centre to undertake landscaping work. We've got a salon and a couple of shops. So a quote from a service user there, it says, I've really enjoyed being team leader, working with other service users and helping them to develop their skills. It's been a great confidence boost for me. So the pathway that we follow, people are introduced to the service, they come in for a work taster. If they can choose to continue, then they're offered a work placement, so that's on-the-job training. So it is unpaid work, but the idea is that they're given the skills to undertake the role within the community and they're built up. And then finally, they can interview for paid employment once they're at a standard where they're able to perform the tasks and feel comfortable undertaking an interview. So I'm going to pass you over to Nina to tell you more about the New Leaf Design and Print.
I'm the project lead on the New Leaf Design and Print project. It's one of our many projects. It was launched this year. We offer creative design solutions for our customers. We have 3 iMacs within the medium secure unit, and we offer design and layout of posters, leaflets, flyers, brochures, basically anything you want printed. We also outsource our print to Access Print, which is a mental health social enterprise in Hackney. We offer professional standard design, and we do creative work, and so far we've really impressed our customers. Currently, our main customer is the Trust, and the communications team is very supportive of us and gives us a lot of work. We offer good rates, and it's based on a real working studio rates. So at the same time as we're saving the Trust money, they're reinvesting in the service user social enterprise. We've been building on successful reputation since April. The service user experience has been very apparent. We can see people taking responsibility for their work, having pride in their work, having a routine and structure, learning new IT skills. We have a variety of backgrounds in the service users from acute rehabilitation, female wards, as well as from the community and low secure services. It can lead on to college and also placements with Access Print in Hackney. We currently have 12 service users, including paid team leaders and others working towards this.
So this is the gentleman that was involved in the landscaping service on not sure if you can read it from there, but just to highlight some of the things he said. He said, landscaping gave me a reason to get up in the morning. The work's varied and we were out in all weathers. It was a chance to do something positive, productive and improve my surroundings for myself and others. They were given positive feedback about the work they were undertaking, and he said that made him feel good, the praise that they received for the gardening. Overall, it's helped him return to the community, and he's actually still coming in to do his landscaping because he really enjoys the project. He's learned a lot about horticulture, he says here, and it's helped him stay on track on his road to recovery, which is really important. So in terms of this, my final slide, in terms of determining success, it's about turning a passive patient into an active worker within a forensic mental health setting. So it's people's choice to engage in our services. It's not something that's expected of them. We're also providing essential on-site services for people at a competitive price while reducing patient stay and promoting recovery. We've been operating for a year and we generated £75,000 income and we're about breaking even. And finally, it's an innovative way of embedding recovery principles within an employment service. Thank you.
So thank you to our speakers, especially for keeping to time, because it means we've got time for questions from the floor. And I think we've had some great examples. What I really liked about all of the speakers is we focused on what impact has it had for real people. And that, I think, is something really important to recognise from each of these disparate examples. So we've heard things about different ways of using money to empower people, training to support and empower people, and help people get back into employment. So lots of different themes that we've got here. I'm just going to turn to our people's panel to see if Angie or Clive have some questions they'd like to pose to the group.
Yes, please.
Thanks.
Thank you. It was really good to hear such like a diverse lot of presentations, but all with the same message, meaning that, you know, there is hope for people with long-term conditions, whether they're physical, mental health conditions. My question, I've got a couple of questions. The first one regarding personalisation budgets is, thank you for making it actually understandable for the first time ever for me. I've sat through so many of these presentations. I was at one the other night and I still didn't understand it, and that was to a group of people that he was trying to sell the thing to. I didn't understand it, and this were a bunch of people. There's absolutely no way they understood it, so thank you, number one. But as you say, I mean, it's something that CCGs and you know, everyone has to get used to the fact that this is going to be in practice next year. But I don't see it advertised anywhere. I don't see anything. When I go to the hospital, when I go to the GPs, if I go to I don't see anything about it. So unless some work's going to be done pretty quickly and pretty kind of nationally with some kind of huge input, people aren't going to know, and people are going to panic because you know, you explained it, and if you went on television and had your own programme, that'd be fantastic. But probably that's not going to happen. So, you know, I don't know how people are going to understand how it can affect them, help them, because a lot of the people I was with the other night said, I don't want to do that, I'm happy with the way things are.
Do you want to pause at that point? Do you want to comment, Alison?
Yeah, I think you're right. During the pilot programme, we couldn't do too much because it only involved 2,700 people, and if you think there's 15 million people with long-term health problems, it's a very small number. And so we do need to increase the amount of communication we do. Last week, NHS England published a guidance document aimed at CCGs, telling them essentially what you've got to do around patient participation, and there was very clearly in there, this is what personal health budgets do. We've developed other tools to be able to do that. One of the things that local CCGs will have to do is they've got a responsibility to let people know about personal health budgets, to give them the right level of support and information about them. And one of the other things we've done is we've got a peer network, People Hub, which they set up themselves an online presence to be able to help and support people. But you're right, this is something that we've got to grow going forward.
Thank you. And I could go on forever with questions, but my other question is about the time credits. which I think is a fantastic idea. And in, you know, with Self-Management UK, I mean, I can't ask Ian any questions because he's my boss. Apart from, can I have a right? No, I'm joking. Because we have a lot of very good, very committed volunteers working for us, and we're always looking for great ways to actually appreciate those people. So that's a fantastic idea, which again I knew nothing about. And I'm just wondering, is it? I may have missed it, and I know you said you're working within the City of London, I think, with young people, but is it national? Where is it available? How do we know about it? Again, how do you advertise it so we know?
So yeah, we're a small social enterprise, so we've been growing over the last few years. So we're kind of in the four corners of England trying to fill in the gaps, if that makes sense.
Yeah.
So we've been commissioned by certain boroughs and organisations. So
Okay.
I suppose if you wanted to be involved, get in touch. But in London, we're only in certain areas. And I suppose what we're trying to do next is grow and expand as an organisation and spread it out. And I suppose seize upon the enthusiasm, you know, of people like yourself who think it's a good idea.
I think it's a great idea to reward volunteers because, you know, it's a way that they can do things that they otherwise probably wouldn't be able to do. Like you said, go to the British Museum, go to St Paul's, that kind of thing, take family. It's a good idea.
Maybe that's part of our pledge, that we can help get the word
I
out
think
about the
that
work
might be
Spice are
mine,
doing.
actually.
Maybe,
Yes.
there we go.
And I have to
Thank
speak
you,
to my boss over there as well. Okay.
Clive, did you have any thoughts? Yes. Sorry, there's just Penny. Okay, and then we'll go over here. Sorry. We'll start, Penny.
Sorry, I just wanted to comment on your comment, which was I have an integrated social and healthcare budget and it's given me my life back. It's brilliant. But I've supported other people with personal health budgets on the trial, and in one particular area, the only way they could get a personal health budget was to take the authority, it's not the authority, the PCT, concern to court and say, I know you're on the trial and give me a budget, because people don't want to change. And that, from my personal experience of supporting others, has been the hardest thing. It's to get people on the ground to do something that's unfamiliar.
Thank you, Penny. Sounds like you've got a busy year ahead, Alison.
Oh, yes.
Yeah. We had a question here. Could you introduce yourselves as you start the questions? Thank you.
Yeah, thanks. Sorry, Alan Cooklin, a psychiatrist in Camden, Islington. Two questions about the personal health budgets. Could you just, I just was fascinated, how does it work in the sense of, does it cover the whole of health or only the continuing healthcare problems? And secondly, what happens if you've got a budget and you're reaching, if you like, the extremes of the end, you know, the boundaries of the budget? You're going beyond what is available. How is that going to work? Do you know?
Yeah. Firstly, personal health budgets are available for a whole range of things within the NHS. There's a few restrictions. Obviously, accident and emergency, you wouldn't want to have a personal health budget in those sorts of situations. If you need an operation, there's things like choose and book to give you choice. Prescription medications and things like that, they're not used for. But for anything else, the potential is there to use them for. The heart of personal health budget is a care plan. And you do the care plan properly, you do the proper care planning, you think about contingencies more than we traditionally do in the NHS, and so very rarely would the budget run out. But this is still NHS services. If something came up, you had a problem that wasn't included in your personal health budget, you would access normal services. If your condition was changing, you may well go back to your care coordinator and say, actually, things are changing, you'd have a review, the amount of budget, the planning is all done. So it's about giving people more control, more choice, and actually thinking a lot wider than we do.
Thank you very much. Well, on the time credit, thank you very much. Time credit issue, I run a number of programs which employ young carers as volunteers. I want to know how to give them time credits.
Yeah, get in touch. So we can talk to you. We have lots of we work with a great young carers organisation in Norfolk already, and it works for young people. Absolutely love this.
Thank you very much.
No.
So we'll speak to David
I'm a
afterwards
personal
about
stand.
how to make that. Brilliant, thank you. Any other questions from the floor? Yes, there's one here and then just behind.
Question, I can't remember your names. You're working together aren't you? With
Charlotte
you,
and Nina.
Charlotte. How are you a sort of a singular entity? Have you got any connections with the rest of the UK in terms of trying to get similar enterprises set up, similar projects, so that they can maybe emulate you? How far has that happened?
At the moment, we're literally a small project. They set it up by having a small number of OT staff, actually, move them over to provide employment services. So rather than doing gardening sessions, we thought we'd create a landscaping service. So it's a really small sort of scale project at the moment. But what we're trying to do is come to a place like this and try and promote it more, because it's certainly something that's needed, especially having worked in the community trying to support people back into employment in previous roles. It's so hard where people have a gap in employment and have lost all that confidence to then work on it and build upon it, and then they're getting all the pressures through government schemes to get into work now. There definitely is a need, and we'd hope to be able to do some work with other organisations, and we've had quite a lot of interest in sort of coming around to view what we do.
Yeah, I really hope so, because it sounds a really excellent thing to be doing.
Thank you. We had a question just behind. Thanks.
Hello, I'm Catherine Gerrans. I'm a practice nurse in Tower Hamlets, and I'm on the CCG governing body. So in my long-term conditioning board lead role, I'm thinking with these personal budgets, how is that going to affect the commissioning decisions that we make as a commissioning group for the voluntary sector organisations which are currently delivering the sort of services I think we're probably talking about?
I think it interacts in a couple of ways. Commissioners do need to think about what they commission and how they release resources to give people personal health budgets. But the other thing is personal health budgets will really inform your commissioning decisions, because you'll be able to see what people are choosing. So for example, one place in the pilots, a lot of people with stroke were choosing not to use the standard rehab, but to use a rehab that was designed by stroke users. And the commissioner went, this is ridiculous, I should just be commissioning this, I'll just commission it. So there is a way that it could, so it's part of the circle and should be part of the circle.
Brilliant, thanks. Thank you. Other questions? Yes, Alex at the front here.
Hi, Alex Beck. I'm Chief Executive of a charity called Pathway. We try and change the way the NHS works with homeless patients. I guess it's another question around personalised budgets. Many of our patients, and we have teams in the secondary care picking up homeless patients when they're admitted to hospital, who don't have status with anybody and therefore don't get access to anything, and therefore services don't get commissioned for them, and so on and so on. I guess my worry is that personalised budgets will be another door which are closed to them and will militate against services being available for that group.
You're quite right. If we do this wrong, it will be another door. But if we do it right, that we will be opening the door, because we will enable people to have services that really work for them. We have done some work, and we're thinking about doing more with the traveller population, people who normally don't access services, to think about, well, why aren't people accessing services, and what can we do to make the services work for them? So personal health budgets, I think, could really address some of those inequalities if people do it.
But the question remains access, doesn't it? I still have to prove my entitlement before you'll come to me. Many of our patients seem to be lost in a black hole of having no entitlement.
Yeah.
So they won't be able to get to you because you won't want to see them, because they won't be part of it.
And that, I think, is not a problem of personal health budgets. Personal health budgets might bring it to fore, but it's actually a problem or an issue that you're trying to address for these people, which I think is great.
Brilliant. Thank you, everyone. In the interest of time, the main plenary starts in 15 minutes at 5:15. So I was instructed to finish at 5 to give you time to benefit from the free tea and coffee outside. Just before we all leave, I just want us all to thank our speakers for some brilliant examples of work that's happening and the impact they've had for the people they've talked about.
I'm going to email you.
And thank you all for being patient listeners as we rattled through the talks. I also, just to pick up on the comment from Angie, just to think about how can we all get the word out about the brilliant examples we just heard about. And so it sounds like there's some direct conversations happen to get SPICE expanded to other areas, and it sounds like we could all help Alison to get the word out and ensure that excluded groups are not excluded. So it's all our duty to help as well. But thank you, everyone. Enjoy tea and coffee.